I welcome you to our conversation with Catherine Naughton from European Disability Forum about the situation for people with disabilities across Europe in the current coronavirus emergency. Obviously, European Disability Forum has done a lot of work on this topic as well, a lot of resources, about a lot of highlighting what's happening and what needs to be addressed, and that should be the focus of the conversation today. So thank you, Catherine, for joining us. And let's jump right into it. And then can we start by just how would you describe the situation for people with disabilities in Europe as an impact of this coronavirus situation?
Thank you very much, Milan, and good morning to everyone who's joined. So what we know about the situation is based on what we've been told by our members, including you, including Inclusion Europe, who've been reporting to us from the beginning about how people with disabilities have been affected by both the COVID-19 pandemic itself and also affected by the measures that have been taken by government to control the spread of the pandemic. So looking at the effect of the pandemic, we've seen right from the beginning in the first announcements that public health announcements said this virus is not going to kill many people apart from older people and people with pre-existing conditions. So already there was a very negative language around the impact on older people and people with disabilities or pre-existing conditions, who are more or less had the feeling that, okay, the population are going to be fine, but we are at risk. And you know, it was used to calm people, but actually it did not have that effect on people with disabilities, this language. Then you will see that some people with disabilities have more likely to contract the condition. And then we've seen as well government health guidelines in some countries, guidelines from societies of anaesthetists or clinical guidelines, actually were instructing hospitals to deprioritize people with disabilities. We know this happens anyway in healthcare. We've known since the World Report on Disability in I think it was 2008, that people with disabilities are more likely to be deprioritized in the face of health services. But here there were instructions which are really discriminatory. Now the World Health Organization have come out and criticized those, but we know that people are still facing discrimination when they try to reach services. Then on top of that, we've seen the quarantine measures. So firstly, the closure of all support services, the closure of community support services, the effects on personal assistance, the closures of schools, inclusive schools, segregated schools, all of this is having a heavy impact on the daily lives of people with disabilities. We've seen quarantine measures taken in some countries really in some cases, exceptions have been made. So eventually exceptions were made in Italy and Spain. Also in Czech Republic, you've told me about Milan, exceptions were made on certain measures for the general population, which had a really hard effect on people with disabilities. So exceptions were made which would allow people with disabilities to go outside and go to their familiar places or have some part of their usual routines. But in the first instance, all of the measures were very, very oppressive and very limiting. And now you have everything from, you know, the difficulties with shopping to the difficulties with homeschooling and the difficulties with activities of daily living, which are no longer supported. So we hear a whole range of daily challenges and problems. And then, like, finally, when we look at indirect effects, so the overall, we know that people with disabilities are more likely to be unemployed or underemployed and or in precarious employment. So the high levels of unemployment and the economic shock which COVID-19 will cause is also likely to have, you know, both current consequences on people with disabilities and their ability to buy food and pay bills and so forth, and also middle to long-term consequences as well. So we think that this, the impact, we need to work together actually to make sure that the long-term impact doesn't, like at the time of the economic crisis in 2008, when the austerity measures taken afterwards had disproportionate impact on women, on older people, on people with disabilities. We need to make sure that people with disabilities don't pay the price for the current pandemic in the long term.
Yeah. Well, thank you. I think I do highlighted the similar patterns for what we can see, maybe from point of view of Inclusion Europe. We would also, I guess I would like also to add to this the situation of families and family carers.
Yeah.
Which is part of the picture as you were describing.
Yep.
I was just yesterday looking at a survey done in Czechia by an organization that supports families caring for autistic children. And some of the stories, of course, like nothing terribly surprising, but at least it kind of brings it to life. It was, for example, a testimony from a single mother who essentially says, like, I am now providing all the care 24/7. There is no support, there is nothing at all, and now to it there is the additional more shopping, more cooking, more stress, more everything. There is no support at all. And another element I would like to highlight out of this, and I think that's actually not been in the picture around the conversations about the impact so far too much, is the inaccessibility of healthcare or therapeutic services, rehabilitation as a consequence of this. Even indirect, people are talking about they basically canceled our therapies or our regular health checks just because, like, preventative measures. Which for some people who need these regularly for all kinds of reasons, but they really need them, is also a very big problem.
It is. And on top of that, Milan, the communication about the public health crisis was from the get-go. I mentioned the fact that they said, okay, only older people, people with pre-existing conditions are really at risk. They also made many public health announcements were made across the EU, national and local level, with no sign language interpretation, no captioning, no plain language, extremely hard for people to understand how suddenly their life has changed from one day to the next. And another thing that you've sparked in my mind, which really worries me now, because I think we don't have information on what is really going on for people who live in closed residential care facilities. So we know from our members in Italy, where most of the group living arrangements are open, where people can usually go and do things outside of their where they live, are now closed inside. We know now we know we're living in Belgium, that now the Belgian government, when they announce the daily death toll of COVID-19, they also admit how many of these people are living in residential care for older people. I have not seen any concrete information on how people in residential facilities for people with disabilities are doing. We know that there's been more attention given in some countries to make sure that providers of services in residential care for older people have personal protective equipment. We know that that has not been possible for people with disabilities who use personal assistance, we know from our members in Spain and Italy that it's been extremely challenging for service providers in disability services and people with disabilities themselves to be able to protect themselves. And I know that the human rights monitoring in institutions is already not very strong. And I really worry about the health condition, the mental and social well-being of people living in closed residential institutions. There was an article last week in the Standaard here in Belgium, which talked about many family members who had not seen each other for 5-6 weeks during this quarantine, because they were either stuck and staying in the residential, or they were completely at home, like the woman you mentioned in Czechia, who is the sole care provider, probably spending hours and hours more per week, even just on getting shopping, than under normal circumstances.
I think, I think that what it does here is kind of highlight the inadequacies of the residential institutional large capacity care for people. And then also, I think it's important, as you mentioned, that so far we are seeing, at least in some countries, not by any definition in most countries, but in quite a few actually, or only a few, numbers from nursing home for old people, but there is literally nothing for care homes for people with disabilities, and the situation will be quite difficult, I think, in some of them. We're very aware that there was news from Sicily, for example. There were news from Poland when there was a large portion of the population in the residential institution infected by coronavirus. So I think that will be another sort of aspect to see if it actually ever gets reported what is going on there. On the other hand, I think it would be, if you are talking about institutions, also examples when there are, and then you mentioned as let's say the mental health toll this will take on people, and that includes the residents and includes the staff. I know of cases where the staff has been locked up in these institutions for over a month now, not leaving them at all, to kind of prevent the spread of the infection on the residents. So there are cases like that. So they're all living there for over a month now without leaving the institution at all. So I think that the general impact of this on people's well-being, and that will be something to see. And it's not necessarily part of the conversation at all.
No. And I think it's sort of probably what we see now, like in any crisis, is a crisis highlights the cracks in the system which already existed. And we know that education systems, health systems, social services are underinvested anyway. And then you see now they have a total lack of capacity to rise up to the current challenges because there's no space, there's no extra leverage within those systems. And in residential care facilities also, you see we will also see the fact that we don't have very strong, clear human rights monitoring in those institutions. We'll pay the price. We don't actually know what's going on at the moment.
Yeah, I think that was what I was thinking of the last couple of days, as you were just saying. I think that what it does now is basically highlights all the things that have been sort of wrong in the system, kind of the focus of our organization's work, be it lack of services, institutionalization, segregation, lack of adequate education, lack of access to healthcare, and now sort of it magnifies these things. At the same time, I have to always remind myself that it probably magnifies them just for us because it's our job to pay attention, and we pay attention to this stuff. I'm not so sure that it magnifies them against to the general people responsible for these things. So I'm finding ways of communicating on these topics so people again are not on the end of the line to receive any support. Is of course an important part of what you are doing at EDF. And maybe so we could move on to the to your work as EDF, and if you would like to highlight some of the work you have done on this topic, and then point people to some particular resources that you've produced.
Okay, thank you, Milan. So, you know that the European Disability Forum, as an umbrella organization at the EU level, are like what we really want to do is to make sure that the EU level responses are fully inclusive and accessible and invested to make sure that people with disabilities, to reduce the impact on them of COVID-19, and then also to make sure that people with disabilities are fully included in the recovery. And so what we've been trying to do is we've been trying to look at all the elements of the response at the EU level and influence the leaders who are making decisions. So the first time that we wrote an open letter to the heads of the institutions, we addressed a letter to the Commissioner responsible for equality, Commissioner Dalli, on the 13th of March, outlining all of the recommendations which we drew from our members. So, you know, if you asked us 2 months ago, what would be your recommendations if the whole country is quarantined and shut down because of a pandemic, we wouldn't have any idea what to write, because it was very hard for us to imagine the situation. But what we did is we just wrote to all our members and said, how is this affecting you? How are people with disabilities in your countries affected? How are the government measures affecting you? And we just compiled together all of these things and create an open set of recommendations, which is on our website. And we build on this, in fact, every few days, because we look very carefully at what Inclusion Europe tell us about people with intellectual disability, what Autism Europe tell us, what European Deaf Blind Union tell us. Then we take new guidance coming from the UN level on social protection, on healthcare, and we try and make sure that this core set of recommendations is very comprehensive. But like I said, we only see, we've only developed these recommendations from hearing about the responses at national level. We couldn't have imagined them before. So we have this core set of recommendations, but then we've also targeted different EU leaders who are responsible for different things. So we knew that to give you an example, we have written directly, and we put all of these letters on our website. So you'll find everything on our resource page. So people can use, copy and paste, be informed. And when we get replies, we will also post them. Because one of the problems we have at the moment is coordination, even amongst ourselves, because so many things are happening at the same time, that we want to make sure that for our members and for the general public, it's very clear what we're doing. So everything goes on this resource page. So we've written to the Commissioner for Health. I mentioned the Commissioner for Equality, but with this Commissioner, we copied in all of those commissioners and vice presidents who are part of the Commission President's task force. We also know that we knew that the EU were having a meeting of the foreign ministers. So we wrote in advance to the commissioners responsible for development cooperation and humanitarian action, asking for them to make sure that the global funds of the EU would also be inclusive and accessible, because we know that the European Union's external programme will also be affected. We know that this is, you know, the countries who are reporting highest levels of deaths at the moment are still in Europe and the US. But we know that the quarantine and lockdown measures are affecting people with disabilities all over the world. And we know as well that where we see high numbers of deaths reported in a country, it doesn't mean that that's exactly what is happening, because not all countries are able to gather the data and the information very clearly. So we're trying to influence the global, what the EU will invest globally as well. We've been sharing a lot of information with members on how to do the advocacy, so sharing recommendations and good practices from different countries. We're part of the International Disability Alliance task forces on advocacy and on communication on COVID-19, to share what we have from our members' work here across the world. So we've participated also in the International Disability Alliance's communication work. They did 2 Facebook Lives where we participated because, we have things to share from how things are going in Europe. And we're now preparing a letter to all the heads of institutions, which will go out today or tomorrow, on the economic recovery and how people with disabilities need to be fully included in the economic recovery, how their services need to be supported in the same way that businesses will be supported. So the attention goes to the things which have, as you said, we saw the cracks in the system in health and social services and healthcare services, and we want to make sure that those parts of the economy are also invested in through this recovery plan.
Yeah, thank you. I personally think that focusing on what's coming next is a very important at this very moment, because yes, there are these immediate consequences for people either directly being affected or being locked up, and all the stuff that we talked about in the first part of this conversation. But I'm very much worried about what's coming next.
Yeah.
And I also think that we already, not surprisingly, see signs that again, people with disabilities might come close to the very end of any kind of considerations for them.
Yes.
Because like all the communication so far about the financial support and the financial measures is usually again about big business and about
Yes.
Okay, we'll bail out airlines, which is beautiful. But what is there about actual support to people like the ones we talked about before? Families caring for their relatives, service providers, personal assistants, and all this stuff to support people. And then already I sometimes I think that we should also be considering sort of the toll on people's lives and literally lives of the economic consequences. We saw it, I think, in Britain very well with the economic consequences of the financial crisis and how it in fact impacted well-being of people in many other countries as well.
Yeah.
So I think that this is something incredibly important at this point.
It is. And I think, Milan, as well, there's going to be something else when you talk about this invisibility. In terms of the issues that governments are talking about and thinking about, it's possible that when countries start to reopen their economy, the mother that you talked about in the Czech Republic of a child with autism, she might be forced to stay home a lot longer.
Yeah.
So it may be that older people, people with pre-existing conditions are obliged to do self-quarantining for longer. And so their families will be prevented from working, from economic activity for longer. And we need to make sure that full social protection net is applied in those cases. Yeah. And this is something that is never at the forefront of policymakers. So it's something we're going to have to work together on to make sure that proper social protection is given to those people who are going to be affected by quarantine for longer. And what if the schools reopen, but they say, children with pre-existing conditions should not yet go to school?
Yeah.
You know, we don't really know how this is going to be rolled out, but what we need to make sure is that when a whole measure for all of the school children is taken, that the children with disabilities are not left behind and left without any educational support.
Whereas the Commission is now sort of, that was the news in the morning anyway, it wasn't announced officially. The Commission is trying to coordinate the response to going out of the lockdown.
Yes.
And I think that possibly could be a space for us to try to target it and do the advocacy work.
Yeah, you're right.
To think of these things, because as you are, like, if we stick with the Czech mother there as an example, it's I think you are very right. And it's schools might or might not open. Some businesses will open, but it's very likely that she will be left alone to provide for her son for many months from now again. So
without being able to work. So, you know, if you were previously, this is the problem, is that income is affected by everyone now, and it may be for people with disabilities over a longer period of time. We have to see and make sure that when that's happening, if that's happening to protect somebody's health, that it's not going to mean that they cannot pay their bills.
Okay, and then you mentioned the advocacy work towards the Commission. What have you seen from the EU as a response so far?
Well, so we haven't had official replies yet from the EU to the requests that we've made. We've seen some differences. So the first public health, the first speeches from the President von der Leyen didn't include any accessibility measures, and that has been changed. So now there's captioning and sign interpretation when she makes announcements. So there's a little bit more awareness. We've seen most of the attention and most of the hot debates between member states is around funding. So you've seen, for those people who follow closely the EU discussions, a lot was around whether or not there would be solidarity, you know, whether countries like Italy and Spain, who were on the cold front with the highest numbers of reported deaths and devastation of an incapacity of their health systems to manage, they wanted help from the EU, and there was difficulty actually mobilizing support from other member states. And so that was very, you know, there was some difficult meetings or teleconferences. Usually it's hard to have arguments over teleconferences, but I think they managed to have some arguments over this particular topic. And now you've seen that there have been some agreements on increased funding. There has been adaptations to existing funding, like in structural funds and the fund for the most deprived, to allow for provision of financial support to people affected by COVID-19. So this is, I think funding is the first the first and most important thing, and it's something that we need to watch very carefully and make sure that funding which had been foreseen for disability support services would be still dedicated to support services for people with disabilities. So if I look at the measures that have a disability inclusive response, there's the structural funds and the Fund for European Aid to the Most Deprived. There has been investment from the EU level in research for finding vaccine, which of course we know is really imperative. You know, to really wipe out the pandemic, we need vaccine. There's also been work from the EU Civil Protection Mechanism, you know, on life-saving humanitarian aid. There was, for example, like not just repatriation of Europeans from around the world, but also joint procurement, I think, of protective equipment. And also the EU's laws on state aid were adapted to allow for governments to spend more at this time for the state aid and for the, you know, the Stability and Growth Pact, which usually prevents people overspending, has been relaxed during this period of time. There were things which in the EU's overall response, I saw when the council, you know, the member states communicated, they said they had 4 priorities. So limiting the spread of the virus. So we're getting involved in public communication and public information measures. But we know that health, managing people's health and health systems is generally done at national level. So national governments have responsibility for that. But of course, and always it's seen as a less important role for the EU. But we see with the pandemic that you cannot say health is only a national issue. If you allow people, goods, services to travel freely, to live, to work, to study, their health and the health as they move, their families, it's also something which is important, falls within the EU's domain more than people wanted to admit before. Ensuring the provision of medical equipment, which has been a challenge everywhere. So it's clear that governments have not had the ability to provide medical equipment, even to frontline health workers. So you've seen cases of young health staff, you know, and I say young, not because young people's lives are more important than older people, but because right from the beginning, they said, oh no, it's only older people who are, you know, a little bit more frail who may die as a result of this. We've seen many young health workers die with COVID-19. So they should have been protected right from the beginning, the same way as people in disability support services should have been protected right from the beginning, but that wasn't possible. So there has been this joint work on public procurement. Promoting research for treatments was another priority, and supporting jobs, businesses and the economy. And this is something where we want to see, as we've just discussed now, because our call is also giving me ideas on what we need to do. This is something that we really need to push for, that this is going to reach out and make sure that people with disabilities and their families, because of course we know that many people with intellectual disabilities live with their families, and probably living with your family. Right now, the situation of the woman who we talked about in the Czech Republic with someone with autism is a really hard graft every day. But the idea of her son being in an institution where she couldn't see him for 6 weeks, it's also like whatever scenario you're in at the moment, these people require support and attention when and it's a last thing that I wanted to say is that when the governments, when the EU or at national level, when the plans are being made for rebuilding the economy, for reinvesting in services and people, organizations representing people with disabilities and families of people with disabilities should be included in these discussions, because only they know how they're being directly and indirectly affected by COVID-19 and by all the pandemic response measures.
Yeah, totally. I think it's going to be the biggest part of our organizations, our work for the upcoming months to ensure that the economic measures and all the support that is going to go into the economy. Actually, I think as used the it should go towards people, not necessarily towards business. So to make sure that to make sure that it reaches people. I think it's also has to go back a little bit. It's not only about money, and you mentioned the protective equipment and all of it. One of the things that is also pretty obvious all across Europe is there was general lack of protective equipment, and even as that kind of improves and there is more of it available, reaching with this stuff people living in their own homes, not in social care providers' limits, is the tough call. I noticed personal assistance providers kind of doing calls for anything they could get their hands on, so they can go to people's houses and help them with their personal hygiene or whatever they need to help with.
Yeah, and they should have. They should be available to them. Yeah.
So that's that. I mean, we've covered, of course, a lot of the topics, and thank you for also the overview that you gave of what the EDF has been doing, and thank you for the work that you are doing on this. Let's give now opportunity to all other participants to jump in, either with a comment of what you've been hearing or a question of your own, and you can do it both directly using the microphone. Just unmute yourself and speak, or you can post your question in the chat, and you'll find a chat and you have the bar with the controls for microphone, camera. There's also a chat window where you can type in your eventual comments or questions. So please come in and share your comments or questions.
Hello, it's Jyrki. Can I?
Hello. Yeah, okay. Sure.
Yes, thank you very much, Milan and Catherine, for this discussion. It's been most important, very important to highlight all these things you have done. The question of this Czech mother, I see it as very important. We know we are all in the margin, and this mother is even in the margin of the margin. And we need all these stories to be told afterwards. How this has affected families, how this affects people, how this affects emotions, and how do we get out of this situation? It worries me a lot. We are going to need huge support afterwards to all these people, all of us. And you mentioned, Catherine, many times also families apart from their loved ones or their sons and daughters. This is my case. I've been a part of my two sons now for 5 weeks, and we have the only connection we have is Skype, and it doesn't work very well. But anyway, there are so many stories, and I think we should gather all these stories. But also what is kind of, I don't know, good thing, but this highlights the situation of people with disabilities in all over the world. And we really have to tell the world all about it. This highlights also the structure of the system or the faults in the system, because for years governments have built institutions, and now in this crisis they try to prohibit gatherings for more than 10 people, and these institutions can have hundreds of people with no limitations inside. As someone of you pointed out, the staff has been living with these people for 5 weeks. This is horrible, and this shows very clearly that this shouldn't be like this. But okay, I'll give the floor to somebody else too, but fantastic discussion. Thank you both.
Thank you. Thank you, Jyrki. It also gives me sort of another idea why we need to collect and tell the people's stories. It's not only about the current situation and the economic recovery, it's also about the potential repetition of the situation. And as everybody follows news and everybody reads that people are saying that both this sort of could come back, even if it subsides now. We'll never know until we have the vaccination, essentially. another, and or potentially some other stuff like this can come back and hit us again. So that's another reason why, like, to make the institutions learn about the impact and prevent some of the very bad mistakes from happening again. So anyone else, please, your questions or comments?
Sandra.
Hello.
Hello. So thank you so much for all this information. I want to share a little bit what is happening in Portugal. And as far as we know, so from CANACRC's point of view, so our associated members, we don't have, up to now, we don't have any case of coronavirus in the clients that we provide services for. We know that some of our residential units are, like all over Europe, also closed, so people are closed inside, basically. They are not able to do the things that they normally do. However, we have this exception that the government issued a norm, let's say, saying that if people that are living in the residential units, if they are able to attend to the activities that they did before without leaving the safety of the residential unit, let's say. So basically it's the organizations that have the residential unit really close to the occupational activity center. So for those, they are still able to attend the services. Also, all the service providers are obliged to continue to serve meals. So either people will go there and pick them up, or they go and take them to people's homes. So that was also a good thing. Also, we had the civil protection. They came to all the organizations, so the services that are still open, so the ones that have residential units, they went there to check if people needed protection, individual protection equipment. And of course, they provided some of it, not all that people needed, but at least they provided something. Also, we know that we had already two people that died, 2 people with disabilities. They were from a big institution that is mainly related with mental health services, but they have people with dual diagnosis, so with mental issues and also with intellectual disability. So 2 of them have died. They were one of the first big institutions to have cases. They are close to Lisbon. So we have a big problem with residential homes for older people. So those are like, I don't know the exact number, but like 60% of the deaths are from people that are living in homes. We have some homes that have like 80% of people infected. So that is really, really bad. Also, we have the government has issued some protective measures in what comes to making sure that the families that needed to stay at home, taking care of the sons and daughters and the family members that are not able to attend to the services, they get a small amount of money, not a lot, but at least something. But like Catherine said, and Milan, and also Jirki, it's really, really a big concern for all of us what is going to happen afterwards with the economic crisis, and like Catherine said, what is going to happen if people that have some kind of additional health problem are not able or not allowed to get to their lives as soon as the others, and their parents or family members will need to be there and take care of them. and provide for them. And also we have learned we had some information, some reports from the people that had personal assistants, that the personal assistant themselves, they just resigned. So people stayed without any choice or any possibility of having their needs met by nobody. So that is also a problem. So basically, I have to say that I'm normally pretty critical in what comes to our government, but at least this time they have shown a little bit of concern from the beginning, because when they started talking about the groups that really were more at risk, they included also people with disabilities already from the beginning. And when they talk about the ones that need to be more protected, let's say, they talk about older people and also people with disabilities. So, and well, let's see. But we are all a bit worried about what is going to happen on the next, if this continues for some more time, because like you already also pointed out, families are not, they don't have the right support to be at home with their sons and daughters that don't understand why they can't go out, why they can't go and meet their friends. Some of them will be depressed. So it's going to be really, really tough the next couple of months, I would say. Thank you.
Yeah, thank you.
Thank you so much for this, Catherine. I think it was you pointed out many interesting things. And I would like to hear, perhaps, how do you see, for instance, because you talked about solidarity in your discourse, right? The solidarity that for the groups of persons with disabilities is sometimes even broadly in relation to other groups. So my question is, how do you see, for instance, in right now, but also in this post-crisis phase, how perhaps the disability groups can strengthen their reach to other groups? So for instance, the elderly groups, that it was, so much spoken that they are also suffering from these measures. The groups of women, for instance, how the numbers of women and girls with disabilities and women and girls in general are suffering from domestic violence in this period. Perhaps if you could talk a little bit about that. Thank you.
Catherine?
Thank you very much. Firstly, it was good to hear the positive story from Portugal, because of course we need to hear positive stories as well, especially to motivate other governments to show that things can be done. And then afterwards on solidarity. So the first thing is that it really shows us as well how, it's in general, when something like this, a crisis of this nature, you see a lot of people who are far from the center of decision making are badly affected. So you see the disproportionate, there was a very good policy briefing from the European Women's Lobby on women bearing carrying the weight of the crisis and of the response. And in this sense, EDF has already tries to work in a very coordinated way with other groups. So for example, within the executive committee of the European Women's Lobby, we have one of our executive committee members. So the statement, the briefing that was prepared by EWL did have a lot of references to women with disabilities in terms of violence, in terms of institutionalization. So we try already to participate within other social movements. So in the women's movement, we're quite advanced in the sense that we've been members for many years, and we participate in their policy making work and their advocacy, and we can feel the results. We've had exchanges and trainings with them, so we understand their language, and but because we're members, we already have this formalized relationship. And we also have structures within EDF which focus on women with disabilities. We have a member from Inclusion Europe there. We also try and link as much as possible. So when we have meetings of that group that we have, the European Women's Lobby also brief us and include us. So we try that under normal circumstances. And we, of course, it's doubly important right now at the moment. Now, with regard to older people, you see really the big connection. That's really strong. And we're working at the moment on one open letter for businesses with Age Platform Europe, looking at just the simple question, which used to be a simple question of how you got your shopping, and now is not a simple question anymore. How do you, as an older person, as a person with pre-existing health condition or a person with disability who's usually with a personal assistant who might have resigned or might have no, how do you actually get food on your table and in your house? So we're going to jointly work with Age Platform. We're preparing a letter for the Euro businesses networks to reach out to actually ask. Some supermarket chains have already provided some kind of services which allow older people, people with disabilities to access shopping, but we're trying to do that together with Age Platform because some of the issues are the same. And we're basically asking businesses to provide services which will meet the needs of their customers with disabilities and their older customers. So we try for those measures and advocacy measures to do it. And then we have to adjust our messages a little bit because, of course, the situation is different for different people. We, in terms of protecting our own organizations that work on equality, we have to work together also between EDF and all of our members to make sure that our organizations can continue to do their work now and in the future. But also we join together with the other equality networks, so defending the rights of lesbian, gay, intersex and transgender people, the network against racism, the youth, and we've written together to the Commissioner for Budget on this, on how to make sure that the organisations working in this field, defending the interests of marginalised people, are still able to function. You know, like do not run out of money, because we didn't talk about this before, but probably very small organizations that require that get public or private donations or grants will all see their budgets affected by the current situation now and by the consequences afterwards. So we have to work together to make sure that civil society organizations can still function and do their jobs now and in the future. But longer term, I think whatever we learn now, we need to keep it in mind for longer term and how we continue to work in the future. We try to do it. We do, like as EDF, we try and say, okay, who is most impacted by this? And so the work we've done with Age Platform on older people has been a lot around accessibility. Because, you know, if a city is made fully accessible for people with disabilities, for older people, many of the things are the same. Not everything is the same if you look through a certain lens. But in general, then we're talking about a huge population. So you'll have seen over past years, bigger advocacy initiatives we've done to drive forward accessibility. We've often tried to do together with Age Platform.
Okay, thank you very much. Thank you everyone for posing your questions and comments and contributions and for being part of this conversation. Thank you, Catherine, for highlighting the issues around Europe. I think you helped us to see many of them very clearly, and then also to see the work that EDF is doing to address these. And of course, there will be plenty more of the work and also jointly with Inclusion Europe to come to address the issues that we talked about, not just the immediate impact, but also the economic consequences of this, and then how to ensure and bring up the solidarity, as it was just now discussed, so that support measures reach out to people who are tend to be left out of these conversations and tend to be left out of the benefits of these. So we must ensure that it's not the case this time around. Thank you very much. I found this conversation very interesting and informative. And again, you can go to EDF's website and find all the resources that Catherine was mentioning there, or you can go to Inclusion Europe website and find there the resources that we are putting together, and the recordings of this and previous conversations. Thank you very much, everyone.
Can I just say one last thing there? I noticed a question. I noticed a question to me in the chat box about services for people with mental health issues who rely on meeting counsellors, social networking for therapy. I think that these are probably services like many other support services which have just been closed from one day to the next and need to be prioritised in the reopening of the economy, that all kinds of support services for people with disabilities need to be prioritised in that reopening. I think we need to have counsellors able to work before hairdressers. Although if you see me within a couple of weeks, you'll probably think I need a hairdresser to work as well, because I'm going to be asking a family member to cut my fringe soon. But just to say to David, I think we need to prioritise the reopening of these services and the provision of alternatives and modified versions of these services to help people come out of this crisis.
Thank you.